to say that just leads us exactly to the backdrop that you have there, and help us understand what Bounce to Zero. You have this amazing backdrop, Bounce to Zero with U equals U. I would love for you to explain to our viewers what the city of New Orleans is doing with Bounce to Zero, what your office has been doing with Bounce to Zero. Explain what Bounce means to people and what U equals U is, because I think the work you guys are doing is incredible.
Yeah, so in our efforts to really address ending the HIV epidemic and moving the needle, we have launched the Bounce to Zero campaign. And Bounce to Zero is locally developed by the community, and is paying homage to bounce culture here in New Orleans. And Bounce to Zero is getting to zero new cases, zero stigma. There's a lot of zeros, and that is to help end the HIV epidemic. And with that effort, we have a website that people can go to, which is bouncetozero.com. And on that website, you can sign the pledge to end HIV stigma, and that means using people's first language. Look for resources that are available, so you can put in a zip code and find where you can access services by parish, by counties. And if you're from the area, we do have a link that goes to outside the New Orleans metro area. We also have developed what's called centralized linkage, and we have testimonial videos on there. And centralized linkage is about, regardless of where you test positive for HIV or have fallen out of care and you want to get linked to care, you can call the number and get linked to care. And we will link you to all the different services that we fund, the service providers that we fund. So with Bounce to Zero, it is about also addressing stigma. And so we have information about PrEP and, pre-exposure prophylaxis, but also PEP. So some people don't know that you need to see a doctor, get an injection, PEP medication within 72 hours. So we have that resource on the website. And then addressing stigma, and we have videos that we've developed coming from perspectives of an African-American woman talking about HIV and how it's important to get in care. We have videos of a couple, one living with HIV and one without, talking about how you can have a normal life, living with HIV, and that women can have babies. Women living with HIV can have babies that are HIV negative. So it's just a lot of information that I think is presented in a helpful manner that is very clear, short, and concise. Because I know everyone's busy and we don't always have the time. But I really recommend people going to the website, just looking through, and if there's anything else that needs to be on it, please let us know.
Vatsana, one of the things that we know that is incredibly important is U equals U, undetectable equals untransmittable. So we know that bringing people's viral loads to undetectable levels just through daily medication use, or can you bring your viral load to undetectable levels? And once you're undetectable, you're untransmittable. So viral suppression for us is so important for us to understand. Does your office follow viral suppressions within the affected metropolitan area, the EMA? And if so, does it break it down so that we can see if disparities exist within different populations with respect to viral suppression?
Yes, most definitely. We do follow viral suppression across different subpopulations, and this is especially important because you can see the disparities among each subpopulation. So I have up viral suppression across the populations, and this is for our metro area for calendar year 2022. You'll see on the graph that in the New Orleans metro area, the pink column represents viral suppression overall, and the red column represents viral suppression among individuals who are in care. So for our metro area, it's 69% overall. So that's including people who are living with HIV, who have not gone into care. They've had at least one primary care visit. And if they are linked to care, we see that the viral suppression increases to 88%. And you see this when you look at across the populations, you see that among incarcerated populations, it's at 67%, right, among people who are linked to care. For youth, it's 81%. For Black men, it's 86%. But when you compare that to white population, subpopulation, it's 93%. So you see the significant disparities among the subpopulations, and that's why it is important that we review this information and tailor our services to assist different subpopulations. And that's why
That's
part
great.
of one of the things that we also work on is making sure that, you know, when we are providing services, while the goal is to address Black MSM, the messages that we send out is targeting everyone because we want to make HIV conversation a normal conversation and have information for people to be able to review and refer back to, because everyone is
Yeah,
affected
this
by HIV.
100%. This is a real tremendous slide. And I know that one of the things that we'll talk about next here is talking about stigma, but there's no question that here we see the disparities that exist not only between populations, but within populations from those that are within care and those that are not in care as well. And this also really drives home the importance of making sure that linkage to care is really part of all of these services that are provided. And this is why that there is a central linkage to care coordinator that has kind of come out of some of the work that you guys have been doing, so that, like you said, no matter where you are in these 8 parishes, there is somebody that can make sure that they can get you into care into one of the clinics or facilities that are providing comprehensive HIV care. Vatsana Chanthala is the Director of Ryan White Services and Resources, a division of New Orleans Health Department. Her office provides funding and resources to 8 parishes of Southeast Louisiana, providing federal dollars to people living with HIV, as well as to their providers that provide their health care, and case managers that help manage their care. Vatsana, thank you so much, and thank you to Urban Health Today for allowing us to talk a bit about HIV disparities. Thank you.